I'd like to do next is have Jaime Torres speak for a couple minutes, and then we'll maybe open up to questions and answers and have an opportunity for us to exchange some more information. Jaime Torres is the Regional Director, Region 2 of the Department of Health and Human Services. He's a good friend and an incredible partner to the Global Healthy Living Foundation, and it is a privilege to join me in welcoming Jaime Torres.
Thank you, Seth. And in a way, I want to congratulate everyone. The second anniversary of the Affordable Care Act. And it's good to remind people that when the president came to power in 2008, he faced a lot. There were 2 wars going on. We were in the middle of a fiscal crisis. But he also knew that there was a huge healthcare crisis that could not be avoided. We had close to 50 million people uninsured. In this land, every 30 minutes, a person was dying because they didn't have an insurance. There's a cost to that. And it's one of those quiet statistics, but if you imagine a jumbo jet crashing every week, this is what we were talking about, what was happening in our country. We had 1 million people going bankrupt every year because of unpaid medical bills. And people are shocked to know that 75% of them had insurance. So we're talking about inadequate insurance that really barely cover the necessities. And also, people who had chronic diseases that you very well know have a lot of expenses, out-of-pocket expenses that people were charging in the credit cards. So the president felt that inaction in healthcare was not an option, and that's why he fought very hard to pass the Affordable Care Act, which, as you mentioned, is the largest piece of healthcare legislation since Medicare and Medicaid in 1965. And sounds very impersonal, but healthcare is also very personal. It affects every person in our nation. And the Affordable Care Act is already benefiting every community in our nation. And like Jay just mentioned now, the effects can be counted on. For example, it is the law of the land, like it was mentioned, that no child below the age of 19 can be denied coverage because of a pre-existing condition. But also, it is the law of the land that any person, any adult, can buy insurance for if they have a pre-existing condition that will be affordable. Also, it is the law of the land now that we want to make sure that your money is spent well. So your premium dollars right now, 80 cents per dollar has to be used on health care, not on management fees or profits. Every insurance company has to spend 80 to 80 cents a dollar of your premiums on health care. It is the law of the land now that women have a right to see an OBGYN without a referral, something that I know it has been a big complaint for many of our sisters and mothers. But also, women were charged more if they bought their own insurance because of being a woman. So being a woman right now is no longer a pre-existing condition. You can buy insurance at a regular, with the same rates as your male counterparts. Being a woman is no reason to be charged more because of the previous unfairness of our healthcare system. Prevention, we know very well that is something that is important and essential for healthcare, but also prevention could be expensive. It is the law of the land now that new plans, or when you renew your plan, have to cover preventive services without copayments and deductibles. So basically, right now you don't have to choose between spending $50 to pay for a copayment for a mammogram or pay for groceries. Right now, you can afford preventive services without spending out of your pocket. And that will be true also for people who have Medicare. Medicare has been strengthened through the Affordable Care Act. One of the ways is that the lifespan has been expanded for another 12 years. And those preventive services that I mentioned earlier are also free to people who have Medicare beginning this year. So basically, if you need to access your colonoscopy or mammogram this year, you can do so without having to pay from your own pockets. And for those people in Medicare who fell into the infamous donut hole, we're closing the donut hole. First, beginning last year, we gave $250 back to those seniors who hit the donut hole. And this year, they're getting 50% off of the brand name medications right at the cashier when they pay for those medications. Also, we're fighting fraud like never before. We're spending over $360 million to fight fraud in Medicare. And for every dollar we spend fighting fraud, we're getting 4 back. So we want to make sure that Medicare is here sustainable And it will be here not only for our parents, but also for our generation to come. So these are some of the important benefits that the Affordable Care Act is really having right now in our communities all over the nation. And again, there will be many more to come in the years to come, because we're expecting by 4 years from now to have over 30 million people newly insured right now that are right now still suffering because they don't have coverage. Because of the Affordable Care Act, there will be over, again, 30 million people newly insured in our nation in a couple of years from now. So again, the Affordable Care Act is large, is big, but it's also personal. It's benefiting every person, every community across our nation.